Senator Gustavo Rivera, thanks so much for being here on New York Now this week.
It is a pleasure to be with you, Dan.
So next week, you're holding hearings on the state's handling of nursing homes during COVID-19. Obviously, you and I both know that tragically more than 6,000 people have died from the virus and been linked to nursing homes out of the state's about 30,000 death toll. Tell me what you're hoping to find out during these hearings.
Well, the first thing that I'll say is that you have to remember this is one in a series of hearings that we in the legislature are doing to kind of really dig deep into what were the responses in different parts of our state government. What are the things that we can do better? And as it relates to our healthcare system, whether it's nursing homes, hospitals, other home care settings, this is the first in a series of hearings that we're going to do, 3 of them. One of them dealing with hospitals, one of them dealing with upstate, and this is the first one is downstate nursing homes and other home care settings. So what I hope to do, the purpose of this is twofold. Number one, accountability. We need to have a clear version in a public discussion about what happened, how everything happened, what are the dates that are involved. I want to really break that down. Where are the accountability? Where are the places where things were broke down? Either whether we're talking about agency mismanagement or whether we're talking about particular entities or providers. Want to learn about all of that. And second, very much tied to it, is what are the changes that we need to do, either administratively or legislatively, to make sure that we are prepared so that when, hopefully never, but we likely will have something else, this happen again, we make sure that that the unnecessary and unwarranted deaths do not happen.
So do we know who's going to be testifying next week? Are members of the Cuomo administration going to be there? Who are the key players that we're looking at in terms of witnesses?
Well, the Assembly and the Senate are still finalizing all of the discussion about the hearings and who is going to testify. As you can imagine, I think you might have covered hearings that I've done in the past. These are going to be long ones, and we want to make sure that we kind of organize it in a way that makes sense, right? We want to make sure that we have everybody, as many parts of this as possible. So we're certainly going to invite agencies from the administration, but we want to make sure that we hear from organizations that are service providers. We want to hear from family members. We want to hear from those folks who can tell us about what was the state of nursing homes and such before the crisis. What are some of the lack of resources that they had even before the crisis struck? And folks that have a clear vision about what we need to do in the future to transform our healthcare system to make sure that that these things don't happen again. So we're still working out all of that, all the folks who are going to be testifying.
So you're not looking just at, the start of March through the present day. You're looking at how equipped nursing homes were before this all started and how that kind of was a domino effect into what happened. Is that what I'm understanding?
Well, certainly. I mean, listen, if you are being asked as a nursing home, for example, to do something today, I mean, but you didn't have the resources to do that even before the crisis came, and maybe it's because not of your own fault, but because of the fact that over the years, this administration might have been having an impact on how these nursing homes were actually reimbursed. What kind of resources they were given even beforehand. We got to ask that. It is all about providing the context, right? The crisis did not happen in a vacuum. When we're talking about lack of PPE as an example, or the fact that some of the PPE that is required now in many of these institutions wasn't required before. You did not need to have N95 masks by the dozens in a back room. You did require them in a hospital because you dealt with people with respiratory ailments, et cetera, but you didn't have that need when you were a nursing home. So now that there's that requirement, I mean, when did that requirement come into effect? How did it impact their day-to-day operations? All of this is about providing context and making sure that we can understand how things happened, why they happened, and what we need to do in the future.
You and our viewers both know about this controversial executive order from the governor's office in late March that said that nursing homes couldn't refuse patients that were recovering from the coronavirus that were still testing positive. I know that that's made a lot of noise around the state, especially from people who were directly impacted by this disease. Is that something that you'll be asking about?
Absolutely. We're going to, I mean, as I said, we want to ask about everything that led up to it. Matter of fact, I got this. I don't know if give me a second. I got a paper a paper calendar. I had to get Staples to dig out something that because if you go to Staples right now, they start in July. So I got them to get an old one out of the trash that starts in January because I'm going to have it here in my desk. And it's going to be about setting the dates. I want to know, when did the first case happen in the United States? When did it happen first in the case here in New York City, in New York State? Where did the first death happen? I want to track it all in a visual way, at least for me, and many of my colleagues will be doing something similar, so that we can really get a sense of everything that happened. So the order on the 25th is absolutely part of our queue of our questions. It won't be not be the only one, but it'll be part of it certainly.
I think it was about a month ago that the State Department of Health came out with its own review of what happened in nursing homes. They basically said that nursing home staff and visitors brought the virus in, and that was it for them. Case closed. They didn't want any other review. They don't want any other review. Tell me why these hearings are necessary from your point of view.
It's necessary because we need to hear in a non-biased setting. We need to hear. This is one of the reasons I love public hearings. This needs to be a public conversation. Certainly that study will be part of our conversation, but I want to hear from nursing home directors all across the state. I want to hear about what happened to them on a week-to-week basis. What are some of the things that choices that they had to make? I want to hear from service providers. I want to hear from family members. I want this to be a public discussion because we all need to know what happened, how it happened. That study by itself is not sufficient.
I'm really interested to see what comes out of it. Senator Rivera, I forgot to mention you're the chair of the Health Committee. That's why we're talking to you. Thanks so much for being on New York Now this week.
It was a pleasure to be here, sir.